Hello, teacher.
Hello, dear Abida.
How are you, teacher?
I'm good. How about you?
I'm good too, thank you. Our question for this week is as follows. What should be done if the implant fails? What steps are taken in case of failure?
Arda, if we need to list our complications related to implants, the most common complication we face after placing the implants is that they somehow get infected and don't stay in the mouth. Why do we place implants? We place them to support the teeth and essentially provide a foundation so that it can support the tooth roots of people who have lost their teeth and have chewing function with the dental supports on top. What happens if we lose the foundation? We would make our patient toothless again. The biggest reason for implant failure is due to a lack of attention to hygiene, which leads to the implants getting infected in some way. Why can implants get infected? If hygiene conditions are not observed during the surgical phase, meaning when the implant is being placed, any infection that develops can eventually lead to the loss of the implants. The first factor is this. The second thing, and the most common issue we encounter with our patients, is when they feel like, I had a nail hammered into my mouth when the implant was placed. What could possibly go wrong? And they start to neglect brushing their teeth and hygiene. We can encounter such situations. In such a situation, actually, we realize that the implants are more delicate than their own dental tissue. From their own dental tissue, we realize they are more delicate. So hygiene, to the care of, needs to be paid more attention to. So compared to a healthy tooth, a person with natural teeth only needs to brush their teeth once a day, while a patient with all implants, brushing once is enough for them. A patient with all their teeth replaced by implants, they need to brush their teeth twice a day. I'm just giving these numbers roughly, so of course, a doctor will guide you on what you need to do. Having a checkup once a month or every 6 months, it really depends on how the doctor guides you, as it varies from person to person. So, not everyone has to have a checkup every 6 months. Some people need to have checkups more frequently because, for various reasons, maybe their hygiene isn't good, or they might be neglecting some things. What needs to be done based on the doctor's guidance? What is the biggest factor for implant loss? After the procedure, insufficient post-operative care, irregular hygiene maintenance, and neglecting doctor checkups are the main reasons for this. So, we pay enough attention to our hygiene. During the implant surgical phase, when the doctor ensures that the clinical conditions are suitable for sterilization and carries it out properly. Implants are quite long-lasting and very successful treatments.
So we don't skip our checkups?
Exactly.
Thank you very much for the valuable information you've provided, Doctor. Looking forward to seeing you in the next job-related chats.
Looking forward to seeing you, Ardacham. Don't follow us, don't recommend each other, and don't neglect to ask questions. Looking forward to seeing you.